My name is Jay Chikeze. I'm the founder CEO of Tremendoc Limited. Tremendoc is a mobile application that allows users, patients, customers gain access to licensed doctors 24/7. It's a mobile app available on the Play Store and the Apple Store. Our users are able to get basic consultations from licensed doctors any time of the day, through their smartphones or any smart device. Of course, it has 2 months, 3 months ago, we noticed a spike, most especially when the lockdown was announced. People realized that they couldn't go to the hospitals out of fear of contracting the coronavirus. Everybody just started, searching how to talk to a doctor remotely, and Tremendoc has been around, and we were popping up, and the people started using it. Tremendoc was born out of a necessity. A problem was noticed, realized. I thought about a solution. My first son was diagnosed with large adenoids when he was born a couple of years ago. What that meant was he always had a cold, and every time we would run to the hospital. And as young parents, we were always very skeptical, meaning that anytime he had a stuffy nose at 2 a.m. in the morning, we would either call our doctor, or if a doctor wasn't available, we'd have to rush to the hospital at 2 a.m., 3 a.m. in the morning. And we're doing this constantly, even though, because at that time we already kind of had an experience of what to do. But as young parents, we wanted to hear from a professional. So that kind of gave me the idea. There will be millions of other parents out there who don't even have access like I do to a lot of doctors, but would need to, contact a doctor for one thing or the other. And then I thought about a situation where a mobile app can be developed where doctors are aggregated and you can have access to doctors for different complaints. We don't directly provide health insurance. We're not an insurance company. But what we have done is we've partnered with insurance companies where telemedicine is part of the plans the insurance companies provide. So we've partnered with the major health insurance companies in the country to provide telemedicine to their enrollees, as they like to call them. We are also looking at partnerships with the state government to provide telemedicine as well as a service to people living in remote areas or rural areas, those who do not have access to smartphones. We're looking at situations where we can do that. Currently, we also provide a service where you can make a call and speak to a customer service who in turn will connect you with a doctor. That service is coming out in the next week. So the future for Tremendoc and technology, it's bright. Healthcare has always, like I said, even before COVID, the solution existed because there's a serious problem to access healthcare in this part of the world, and that's why it was because of that problem that the solution was created. So beyond now, telemedicine will still prevail. When it comes to technology, we're thinking about interesting ways of, bringing up other interesting ideas on how to provide a holistic access to healthcare. Doctors who consult remotely, there's a barrier to the full consultation to what they can do. So we are looking at how technology can solve that, where doctors can see the user's temperature, can tell the user's temperature, can also tell the blood pressure of the user, the sugar level of the user, the heart rate, the pulse of the user. So we're working on wearable devices where this can be used to ascertain all these metrics so that the doctor has a concise consultation with the user. The major challenge is education, educating the populace around telemedicine. A lot of people do not understand how it's possible for a doctor to consult with a patient without physically examining that patient. What Tremendoc is doing currently is just that we have taken technology. We've provided a solution. We've aggregated doctors on the platform to do the same thing that you've been doing for a long time, where you've been talking to a relative or a friend who is a medical doctor. To use telemedicine as a frontline consultation process, I think it's very important that one thing we need to understand is that we have very few doctors in the country. WHO standard is 1 doctor to 600 people. As of 2 years ago, Nigeria was at 1 doctor to 6,000 people. We really are lacking a lot of doctors. And I think one way to solve that is if telemedicine is used as a frontline service first before you have to walk into a hospital. Telemedicine cannot eliminate physical hospitals. I would not. It's not trying to do that. But to cope the situation that we are facing currently today, the country needs to use telemedicine as a frontline consultation tool before you now have to walk into the doctor. The doctors now refer you to go to the hospital for proper examination or for further examination, maybe to run a test or to meet a consultant or a specialist. I think I mentioned that before. We have a phone call service that we are introducing in a couple of days. So what that would mean is that if you don't have a smartphone, you can take advantage of it. You register on our website and then you're able to make those calls. We'll see that you have a valid proposition. We're also looking at working with schools and primary healthcare centers, working with organizations to see how we can provide our devices into primary healthcare centers. Most of these centers don't have medical doctors. They just have health professionals attending to patients. What we are looking at doing is provide devices where our doctors, people can go there, access our doctors remotely through the devices. And then hopefully we partner with state governments and they're able to work with us to provide these devices in primary healthcare centers. There are a lot of primary healthcare centers in the country. All we want to do is partner with them and see how we can enhance what they are doing currently. 70% of the complaints have been other health-related issues. We have pregnant women there. We have young adults who are sexually active. You have toddlers who parents call in for their kids. Let's not forget that COVID is not the only ailment that is out there. There are people who actually have malaria, people who actually have other kinds of ailments. COVID didn't all of a sudden chase all those things away. But the spike is caused by the fact that people are afraid to go to the hospital, because with this little sickness I have now, I come out with COVID. So 70% of what we get are other ailments, and 30% are, the symptoms look like COVID related, and our doctors are quick to refer them to call the NCDC numbers and have a test done.